Okay, so today I'll be checking your cranial nerve 1, your olfactory nerve. This is in relation to your sense of smell, which is also connected to your sense of taste as well. So I'm going to ask you to close both of your eyes and cover one nostril completely. I'm going to let you know if you can smell this.
I smell it.
You smell it? Okay. Yeah, the other one.
I smell it.
Can you give me an idea of what you smell?
I smell like a coconut, rich coconut scent.
Okay, that's good. That's perfect. You can open your eyes. So if you wouldn't have been able to smell the scent, at least to its full potential, it would be called anosmia, and that's when people complain of a loss of smell and usually release the loss of taste as well.
Oh, okay.
I have Sedem here, and she's gonna help me. She's gonna allow me to perform the cranial nerve to optic nerve test to test her acuity. So, as you know, today we're gonna be using the Snelling chart to test your acuity. So you are already positioned 20 feet apart, and before you read anything, I want to ask, do you wear any glasses?
No, I do not.
Awesome. Okay. So, can you let me know what's the smallest number you can read here? What's the smallest letter you can read?
Right where your hand is. Your
Right
hand
here.
is perfect. Yeah.
Awesome. So to start the Snelling test, to start using the Snelling test, I'm going to ask you to cover one eye, whichever one, and let me know if you can read here.
Perfect, I can.
Okay. Let me know what these are.
PHUNTDZ.
Awesome. So we can switch to the other eye. The same thing.
PHUNTDZ.
Awesome. Okay. So you seem to have 20/20 vision, and we know that we're based on your acuity. So this basically means that you are 20 feet apart. So you can see these letters 20 feet apart, and a normal person would see it also 20 feet apart. So you have 20 feet vision, which is perfect. Another way you could perform this test is through the Rosenbaum card. It looks very similar to this, but however it's smaller. It's almost like a card, and you would do it 14 inches away at distance, and it will perform the same thing.
Oh, wow.
Okay, so for this test, we're going to be testing her cranial nerve 2, which is her optic nerve, and we're doing so to test her 6 visual fields. So in order to do so, we're gonna have her seated, and we're gonna stand right in front of her, somewhat close. I'm gonna ask her to see kind of in the middle of these two letters to keep your eyes parallel to the floor. I'm gonna ask you to cover one of your eyes, and I'm gonna test your peripheral visions. So,
4, 3, 2, 2, 3, and 4.
awesome. Okay. Then we can switch to the other eye to perform the same thing.
4, 3, 2, 2, 3, and 4.
Awesome, it's pretty good. Hello, I'm here with Sedem again, and we're gonna be performing the optic disc exam to test her cranial nerve 2, which is her optic nerve, also her ocular fundi. So in order to perform this more accurately, we will usually darken the room. However, due to a lot of natural light, there's only so much we can do. The next step would be to set the ophthalmoscope to 0 to avoid any conversion or diversion of light. And to do so, we would just set this to 0 with the dials on the side. To test, if I'm starting off with her right eye, I would use my right hand and my right eye to see her right eye, and vice versa with her left eye. I would ask Sedem to look over and above my shoulder, just to keep her eyes steady while I'm performing the exam. I would hold the ophthalmoscope relatively close to her, moving slowly towards her at about 15 degrees to the midline. And the first thing I would look for would be a red reflex, as it would confirm that I am in alignment with the pupil. So when turning on the ophthalmoscope, I would see the circle of light by the stethoscope, and then so if you could look over. After finding the red reflex, I would follow the red reflex to visualize the retina, the optic disc, and the vessels. Then I would adjust the focus with the lens wheel as needed for clarity. What I would be looking for while performing the optic disc exam is I'm looking for sharpness or clarity of the disc outline. If I see any blurred disc, that can indicate papilledema, which is caused by increased intracranial pressure. Observing the eye retina, I would look for any lesions, and I would observe the arteries and the veins for abnormalities. And I would, while performing, I would try to be careful to avoid touching like the eyelashes or the face of the patient, and then I would compare both eyes for any differences. Everything. Hello, so today we'll be testing cranial nerve 2 and 3, which will be her optic and oculomotor nerves. To correctly perform this exam, we'll be looking for direct and consensual pupil reactions, and by doing so, I will be performing the swim leg test on her, where I will be directly shining a light on, for example, her right eye, and I'll be looking to see that her right eye will constrict, and then looking over to see that her left eye will constrict as well. And then I would flip it to the other side and do the same thing on her left eye to make sure that her cranial nerve 2 and 3 are properly working. Now, let's say if during the exam I find that pupils aren't equally constricted, I would find cranial nerve 2 lesion, which is when both eyes constrict with light stimulation on normal side and neither constrict with light stimulation on lesion side. And for cranial nerve 3 lesion, only one side constricts with light stimulation on both sides, lesion on eye that does not constrict. So to perform this test, I will do as I stated. Shine the light on the right eye constricted, left eye constricted as well. Shine the light on the left eye constricted, right eye constricted as well. And yep. Okay. Okay, so right now we're going to be testing cranial nerve 3, which is your oculomotor. So in order to do so, I'm going to face you and kind of stand like in front of you slightly to one side when I'm sitting to your right. And I'm going to make sure that I'm not blocking your field of vision. Are you able to look at the wall without me blocking your field of vision?
Perfect.
Okay, awesome. Okay. So I'm going to instruct you to look towards the distant point of the wall, and I'm going to focus at the root of your nose, using all of my peripheral vision. So while doing so, I'm going to look for ptosis while you have your eyes open, which is going to be that for your cranial nerve 3. So going to observe for pupil sizes to make sure that you have normal pupil sizes, that they're the same size. When they are the same size, it's called isochoria. However, when they're not, that means you have a cranial nerve 3 lesion, which is called anisocoria. And the last thing I'll be looking for is blephorospasm. There we go. And I'm going to ask, in order to do so, I'm going to ask you to close your eyes. And during this, I'm going to see your eyelid movements. And everything looks fine. Basically, during this, I'm going to see if you have like a lot of like eyelid movement to make sure you don't have. So, in continuation to testing your cranial nerve 3, I will be performing the accommodation test on you. So to do so, I'm going to slightly keep to your right side. Kind of make sure that you still have a good distant point to look at, and that I'm not blocking your view. So to do so, I'm going to make a finger to your with my right hand, and I'm going to place it on your right eye, around 3 to 4 inches away. I'm going to instruct you to look at my finger, at the point of my finger, and then look at the wall. And I'm going to ask you to do that 3 to 5 times. So, wall, look at my finger, look at my wall, finger, wall, finger, wall. Good. Okay. So then I'm gonna proceed to your left side, and pretty much just perform the same thing. So finger, wall, finger, wall, finger, wall, finger, wall. Okay. Good. Um. So. So the reason for the accommodation test is to observe for lens to change thickness when focusing between near and far. So normal lens thickness will be with near vision, and abnormal lens tend to fail to this to accommodate during the accommodation test. Continuation, I will be testing your cranial nerve 3, which is your ocular motor, along with your cranial nerve 4 and 5, which is your trochlear and abducens nerve. In order to do so, I will be performing the H and X exams on you. So to do so, I will be around 3 to 4 feet, 3 feet in front of you, and I would instruct you to follow my finger. You don't have to do it right now, but I will basically be making an X sort of figure and an X and H sort of figure for you to follow. So follow my finger. Here I am testing your superior rectus muscle, your lateral rectus, and your inferior rectus. If you follow here, I'll be testing your medial rectus, your inferior rectus, and then here your inferior oblique and your superior oblique, and then performing the X. Yep, all good. During this exam, I am observing for the presence of palsies and stage nystagmus and the presence of saccades or unyoked eye movements. Into that exam, I want to state that the nerves that innervates each of the extraocular muscles are the lateral rectus for cranial nerve 6, the superior oblique for cranial nerve 4, and all else for cranial nerve 3. Hello, so we're gonna be testing cranial nerve 5, which is your trigeminal nerve. So there is 3 parts of the trigeminal nerve. It is kind of like divided like this. So this one is your V1 ophthalmic. This is V2 maxillary, and this is V3 mandibular. So in order to do testing, one is gonna be the light touch with a cotton ball right here, and then the pain with the neural spin wheel. So I'm gonna ask that you close your eyes. Do you feel that?
Mm-hmm.
Do you feel that?
Mm-hmm.
Do you feel that?
Mm-hmm.
Okay. Yes?
Mm-hmm.
Yes?
Mm-hmm.
Yes. Okay. Did it feel the same?
Yeah.
Okay. Now I'm gonna proceed with the pinwheel. Do you feel that?
Mm-hmm.
Do you feel that?
Mm-hmm.
Do you feel that?
Mm-hmm.
Do you feel this side?
Mm-hmm.
How about this side?
Mm-hmm.
Does it feel the same side to side?
Yeah.
Okay. Awesome. So the next thing I'm gonna do is test the motor function of your trigeminal. So to do that, I'm gonna test your mastication with your masseter and temporalis. So I'm gonna touch around here, and if you could please bite down. Okay, bite down one more time. Awesome. Okay, then I'm gonna test your temporalis. So around here, could you bite down, please? Okay, one more time. Awesome. Okay. And then the next thing I'm gonna ask if you could face forward. I'm gonna test your trigeminal wall reflex. So open your mouth slightly, and I'm gonna place my thumb on your chin. Just ever so slightly, like just like that is perfect. I'm gonna apply a little bit of pressure, and then I'm going to just hit my thumb 2 to 3 times and see how quickly you move the lower jaw upwards. Okay. You can relax a little bit. Okay. Alright. Okay, so we're gonna be testing cranial nerve 5 and 7 using the cranial superficial reflex test. Cranial nerve 5 is a trigeminal, it's the afferent sensory portion, and cranial nerve 7 is the facial efferent motor portion of the reflex. So to do so, I'm already beside Sedem, which is my patient for today. And I'm going to ask her to look to the right side so that I can test her left eye for the reflex. I'm going to touch her cornea, not the sclera, and I'm gonna poke at her eye 3 to 5 times to assess properly. So there's 1, 2, and 3. Okay. Now we're gonna switch sides. Okay, I'm gonna ask you to look to the left. 1, 2, sorry. 3, okay. Alright. Okay, so we're gonna be testing cranial nerve 7, which is the facial nerve. So in order to do so, we're gonna test the muscles of the facial expression, which is the upper motor neuron, which is the cortex, and then the lower motor neuron, which is the brainstem. So in order to fulfill the test, I'm going to ask you to do a couple of things. So first, I'm going to ask for you to raise your eyebrows. Okay. Then I'm going to ask you to close your eyes tightly, and I'm going to try to open them, okay? Good, okay. If you could smile, like really hard, like you just got like accepted to your dream school, like there you go, okay. And then I'm gonna ask you to puff up your cheeks, and I'm just going to press. Okay. Okay. So the facial nerve, just so you know, also supplies taste to the interior 2/3 of the tongue. Oh, everything seemed normal. Okay, so today we're gonna be checking cranial nerve 8, which is the vestibulocochlear nerve. So before I start any cochlear examination, I want to first check the ear canal bilaterally to rule out any pathology or blockage. So please, also just clear enough. Great, clear enough. All right. So the first test I'm going to perform is going to be the rubbing fingers test. We're going to ask the patient Sedem to close her eyes and cover her opposing ear. And I'm going to rub my fingers and ask that she lets me know when she can't hear. Okay, so you can close your eyes. I can't hear. Okay, perfect. Now switch.
I can't hear.
Awesome. Okay. Okay, so the next test that I will be doing is the Weber test, and I will be using the 512 hertz tuning fork, medical grade tuning fork. So in order to do so, I'm going to cause vibration between the tuning fork, either by flicking it or hitting it, and then I'm going to place it right in the middle of her head, and she's going to let me know which side of the ear she hears it the most. So
The right side.
right side, okay. Okay, so the next test, since she heard it more on the right side, we're going to be doing Renee's test on her right ear. So once again, I'm going to cause a vibration on the tuning fork. I'm going to place the base of the tuning fork on her bone. And when she tells me that she can no longer hear it, I'm going to flip it to the U portion of the tuning fork, and she's going to let me know when she can no longer hear it.
I can no longer hear it.
Okay. Can you hear it?
Yeah, I hear it.
Okay. So Once again, we're using a 512 hertz tuning fork. So the Weber test gives no lateralization, and to restate, lateralization is an abnormal finding and it warrants further investigation with Renee's test. A normal finding for Renee's test is air conduction will be greater than bone conduction. Yeah. Okay, so we're gonna be testing cranial nerve 8, which is the vestibulocochlear nerve. We're gonna be testing for vestibular, which is another word for balance, and then we're gonna do so by doing the tandem gait test. So first I'm gonna ask Sedem to have her sight forward, eyes open, and walk heel to toe, and I'm gonna be beside her to catch her just in case. So you can proceed. Okay, that's good. Now on the way back, I'm gonna ask that you do it with your eyes. And then just continue with your eyes closed. I'm gonna be here in case you lose your balance. Okay, perfect. Okay, so we're gonna continue to test cranial nerve 8, which is a vestibulocochlear nerve. Now we're gonna test for resting nystagmus. Resting nystagmus is involuntary rhythmic eye movements that occur when a person is looking straight ahead. So I'm gonna ask that my patient Sedem look straight at me, and I'm gonna assess both eyes to see if she has resting nystagmus. Well, she's gonna look straight to the wall, and I'm gonna look into her eyes. So if you can look straight. All right, all seems good. Next we're gonna do the head thrust impulse test. So the reason why we do this test is because visual fixation is maintained in a normal exam. Loss of visual fixation indicates a lesion on the ipsilateral side of rotation. So in order to proceed with the test, I'm going to grab Sedem's head and move it. Ready? That was cranial nerve 8. Okay, so for this one, we're going to be testing cranial nerve 9, which is the glossopharyngeal nerve. The glossopharyngeal nerve provides taste to the posterior 1/3 of the tongue. Cranial nerve 9, once again, the glossopharyngeal, is the afferent sensory portion. And cranial nerve 10, which is vagus, is the efferent motor portion. So in order to assess this nerve, I'm going to perform the gag throat reflex on Sedem. So I'm going to ask the patient to open her mouth, and I will insert in order to provoke a gag reflex. Okay. Okay. All right, so we're gonna be testing cranial nerve 10, which is the vagus nerve. So to do so, I'm gonna assess my patient's speech, and I'm gonna ask her to swallow some water while I palpate both sides of her throat. How are you doing today?
I'm very good.
How was your day?
Very, very good.
Okay. Could you drink some water for me while I palpate both sides of your throat?
Right.
Yeah. Okay. Everything seems normal. The next thing I'm gonna do is I'm going to assess for palate elevation lesions. So to do so, I'm gonna ask my patient to just say ah and open her mouth as wide as she can while I flash the light to her throat. Okay.
Ah.
Okay. Okay. So she seems to not have any lesions, but if she did, one palate would not elevate, which is the side of the lesion, and the uvula would deviate away from the side of the lesion. For the physiological portion of it, I'm gonna ask my patient to once again open her mouth and repeat three to five short ahs. So if you could do so, please.
Ah, 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 ah,
Lesion was detected. The lesion prevents one side of the palate from elevating properly and causes ipsilateral deviation of the uvula, and the uvula will point away from the side of the lesion. Okay, so we are going to be assessing cranial nerve 11, which is the accessory nerve. So to do so, I'm going to be observing her sternocleidomastoid muscle and her trapezius muscles. In order to do so, I'm going to add resistance to her shoulders. So if you could shrug your shoulders upward, and I'm going to try to pull them down. Good. Okay. I'm going to ask you to bend and rotate your head, and then I'm going to try to open here. This is for the sternocleidomastoid, and then do the same thing on the other side. Don't let me push. Good. Okay. Motor only cranial nerve. And yeah, that'll be all. So our last nerve that we're gonna be testing is cranial nerve 12, which is the hypoglossal nerve. In order to test for this nerve, I'm going to use a light and at rest examine the tongue for atrophy and fasciculation. So you can stick out your tongue and see. Can you stick it out all the way? Okay. So by doing so, I was checking the tongue for atrophy and once again fasciculation. If she had a lesion, atrophy and fasciculation on the ipsilateral side of lesion would show. Using the light, I observed for tongue protrusion as well. Asking for her to stick her tongue out as far as possible and observe for tongue deviation. If she had a lesion, the deviation would be to the side of the lesion. So for the next motor portion of assessing the nerve, I'm gonna test for the muscle strength bilaterally. I'm gonna ask the patient to push out on her cheek with her tongue. So it will look something like that. So I'm gonna use like 2 to 3 fingers to push against her tongue. She's gonna try to resist that strength. I'm gonna compare left and right, and if she had a lesion, there will be a weak side contralateral to lesion, and sensory. As far as sensory, this is only motor, so there's no sensory. All right. So we're gonna do your right side first. So try not to let it. Good. Left side. Good. Okay. So yeah, no lesion. It seems fit on both sides. And yeah.